Fellow Albertans, we are facing an emergency that requires immediate action to save lives and to prevent an ongoing crisis in our healthcare system. After 19 months of COVID-19, we are all exhausted by the way this disease has upended our lives. We all wish we could simply turn the page and leave COVID in the past. But this disease is an invisible and ever-changing foe, and we have no choice but to face the grave threat of this fourth wave head-on. That is why today the government has declared a state of public health emergency. 2 weeks ago, we presented modeling on the direction of this wave. The high-end scenario of that model projected over 300 intensive care admissions by the end of this month. But recent trends show that we are exceeding that high-end projection and that we may run out of staffed intensive care beds within the next 10 days. How bad this situation becomes and how long it lasts is now up to each and every one of us. To prevent an ongoing crisis, we must do three things urgently. First, we must maximize our healthcare capacity. Secondly, reduce transmission of the virus by reducing interaction with other people. And thirdly, we have to get as many people as possible vaccinated. On healthcare capacity, our frontline workers are doing incredibly heroic work. After 19 months of COVID, many of them are completely exhausted, and understandably. Alberta Health Services is doing everything possible to staff more beds for the growing number of COVID patients. Dr. Verna Yu will have more to say about that in a moment, but there are still real limits. Let me put this in context for you. Even with the biggest per capita healthcare budget in Canada, Alberta hospitals normally, outside of a COVID year, have a total of 173 staffed intensive care beds, and we usually operate at about 85% of capacity. But as of today, we have 269 ICU patients. We've made the difficult decision to postpone thousands of surgeries and other procedures to free up staff and resources for COVID patients. And we're sparing no expense to expand capacity. But unless we slow transmission, particularly amongst unvaccinated Albertans, we simply will not be able to provide adequate care to everyone who gets sick based on current trends. Which brings me to the second urgent priority, which is increasing vaccination rates. This is a crisis of the unvaccinated. 90% of our intensive care patients are unvaccinated, and if you are between the ages of 20 and 50, you are 50 to 60 times more likely to be hospitalized with COVID than if you are vaccinated. So I do not say this, by the way, to stigmatize people, but we all need to understand that the decision not to get vaccinated is not just a personal choice. It has real consequences for our whole society and for the ability of our hospitals to cope. COVID is hitting Alberta harder than anywhere in Canada because we have the lowest rate of vaccination in Canada. This is despite 9 months of educating people about the safety and effectiveness of the vaccines, despite making it as convenient as possible to get the jab in every corner of the province, including 1,400 pharmacies, and despite Alberta having the most generous incentives in the country, from million-dollar lottery prizes to $100 gift cards to those who get vaccinated. I want to thank the nearly 80% of adult Albertans who have stepped up to protect themselves, their loved ones, and our healthcare system and its workers. But it has now become clear that to save lives and prevent business closures, we must go further in encouraging vaccination and reducing the chance of infection for those who are unprotected. That is why the government has reluctantly decided to adopt the restriction exemption program, a proof of vaccination program for participation in certain discretionary activities that have a higher risk of viral transmission. No one will be compelled to get vaccinated against their wishes, and a negative test option will be offered as an alternative. But with unvaccinated patients overwhelming our hospitals, this is now the only responsible choice that we have. I had earlier committed not to introduce proof of vaccination because of concerns I had around privacy rights. But the government's first obligation must be to avoid large numbers of preventable deaths. We must deal with the reality that we are facing. We cannot wish it away. Morally, ethically, and legally, the protection of life must be our paramount concern. I believe that the vast majority of Albertans understand this and support this. Our third key goal is to reduce viral transmission. If we fail to do so, the pressure on our hospitals will be unsustainable for weeks to come. So this is truly a life and death matter. That is why the government has authorized a series of new public health measures, such as capacity limits, limits on indoor socializing, requiring people to work from home whenever possible, physical distancing, and more that will be detailed by the Minister of Health in a moment. We have sought to minimize the impact of new health measures on children, recognizing that they have suffered disproportionately throughout the last 19 months, even though they are at the lowest risk of severe COVID outcomes. We'll also avoid business closures by allowing hospitality and other businesses to participate in the new proof of vaccination program as an alternative. This means that businesses can operate safely while cutting viral transmission at the same time. I know that we had all hoped this summer that we could put COVID behind us once and for all. That was certainly my hope, and I said so very clearly. Based on our analysis of other jurisdictions around the world with similar rates of vaccination, we believed that we could prudently move away from addressing COVID as a pandemic and towards an endemic. It is now clear that we were wrong, and for that, I apologize. Jurisdictions all around the world have been learning how to deal with this ever-changing threat to human life. Often that has been a process of trial and error. I know that we all want certainty and predictability during these difficult times. But one thing we've learned about COVID is that it simply is not predictable. We must address the challenge as it emerges, seeking as we have from the beginning to protect both lives and livelihoods. We have all seen the increasingly divisive debate about how to address the challenge of COVID. But whatever your views, I ask that you try to find some common ground with your fellow Albertans. Please give a thought or a prayer for the hundreds of COVID patients in our hospitals right now, many of them fighting for their lives. Please find some way of showing gratitude to our amazing frontline healthcare workers who are coping with unimaginable stress. Please show patience for people who have different views than yours. And please do your part to save lives and protect our hospitals by staying at home when you can, limiting contact with other people, and protecting yourself with the vaccine if you have not yet done so. Through all of the loss, pain, and anxiety of the last 19 months, we have proven that we are an amazingly resilient people. Albertans can and will overcome any challenge that we put our minds to, just as we'll overcome this great challenge of our generation. Thank you, and with that, I will now invite Minister Shandro to provide further information.
Thank you, Premier, and good evening, everyone. Premier has outlined how serious the current situation is for our healthcare system as the Delta variant spreads quickly, mostly among those who are not yet vaccinated. And we have to take aggressive steps to contain the spread to ensure that our hospitals have the capacity to help those who urgently need care here in Alberta. We have to stop the spread now, and we have to stop it across the province. I'd like to go over the public health measures in a bit more detail so that everyone is clear on the steps that we need to take together. As of 12:01 a.m. on September 16th, a number of new public health restrictions will come into effect. First, masking will continue to be mandatory in all indoor public spaces, and physical distancing will also now be required. This means that in public places, we all must maintain 2 meters distance from anyone outside our household. All private indoor social gatherings for vaccinated individuals, so this is indoor social gatherings for all of us who are vaccinated, will be limited to only those in the same household plus one other household to a maximum of 10. There are no restrictions on children under 12. Now, individuals who live alone may have up to 2 non-household vaccinated close contacts. For unvaccinated people who are 12 and older, they will not be permitted to attend any private indoor social gatherings. Indoor social gathering restrictions do not apply to those providing services such as healthcare, home care, child care, or other professional services in your private residence. Outdoor private gatherings are permitted to a maximum of 200 people and with physical distancing required for people not from the same household. Outdoor public events with no indoor portion, except for the washrooms, of course, have no attendance restrictions but must maintain physical distancing between households or 2 close contacts for those who live alone. For places of worship will be restricted to a maximum of 1/3 of the venue's normal in-person capacity, and masking will be required. As well, physical distancing between households must be maintained, and individuals who live alone can sit with their 2 close contacts. In-person faith group meetings can continue, but attendees must wear masks and maintain physical distancing. These limits are mandatory and will be in place province-wide. Now, turning to schools, mandatory masking is now in place for all students in grades 4 and up, plus staff and teachers. Elementary schools will return to class cohorting. For physical activities in schools, youth who are 18 and under will not be required to mask or maintain physical distancing of 2 meters when participating in the physical activity. Spectator attendance for youth sports is limited to 1/3 capacity, with masking and physical distancing between households being required. And these are the same requirements for children's sports activities outside of school. Outdoor activities can continue with no restrictions. Children's day camps must also comply with masking and physical distancing requirements, and overnight camps must shift to a cohort model. Finally, we are moving to a mandatory work-from-home order unless an employer has determined a physical presence is required for operational effectiveness. Now, for anyone who has to go into work, masks are mandatory in all indoor workplaces, except when alone in an office or cubicle safely distanced from others or where an appropriate barrier is in place. And this includes any location where employees are present in person and applies to visitors, including delivery personnel and employees or contractors. There are also additional restrictions that will be coming into effect on September 20th. For September 20th, the following restrictions will begin. First, all indoor wedding and funeral ceremonies will be limited to no more than 50 people or 50% of the fire code capacity, whichever is less, when indoors. And indoor receptions will not be permitted. All outdoor wedding and funeral ceremonies and receptions must be limited to 200 people and must follow the current liquor restrictions. Liquor sales end at 10 p.m. and consumption ends at 11 p.m. And physical distancing between households is required. Facilities which are hosting weddings and funerals are encouraged to implement the restrictions exemption program, and I'll talk about this program more in just a little bit. As well, all restaurants, bars, pubs, and lounges must close their indoor dining. Outdoor dining can continue with adherence to the following public health measures. First, there must be a maximum of 6 people from the same immediate household at a table and no movement between tables. If you live alone, you may dine with up to 2 close contacts. No liquor sales after 10 p.m. and no liquor consumption after 11. We are encouraging Albertans to use takeout, delivery, drive-through, and curbside pickup whenever possible. As well, also starting on September 20th, there will be new measures for businesses. For indoor entertainment venues such as banquet halls, conference centers, trade shows, concert venues, casinos, and community centers, these are restricted to 1/3 of their fire code occupancy. Masking and physical distancing between households must be maintained. Individuals who live alone can attend with their 2 close contacts. Retail service businesses will have restricted capacity to 1/3 of their fire code occupancy. And this includes entertainment and event services, so for example, movie theaters, libraries, museums, and galleries. Now, while shopping or going to a movie, we ask that you only do so with your household members, or if you live alone, 2 close contacts. The 1/3 of capacity restriction also applies to indoor entertainment like racing centers, bingo halls, water and amusement parks. It also includes indoor fitness, recreation, sports and physical activity centers, including dance and yoga studios, martial arts, gymnastics, and private or public swimming pools. In addition, for these facilities, there will be no group fitness, classes, team practices, or games. All adult indoor group classes and team sports are not permitted. Now, facilities can be open for distanced individual exercise or one-on-one training only, as long as 3 meters of distancing is in place between individuals. And instructors can use facilities to broadcast virtual fitness classes, but there can be no group class. Casinos may remain open at 1/3 of their fire code occupancy, with liquor sales ending at 10 p.m. and consumption, again, ending at 11. Outdoor seasonal markets may continue as long as public health measures are in place. Your doctor's office and other health professionals will continue to be able to offer in-person services. Along with these public health measures, starting September 20th as well, we are implementing a province-wide restrictions exemption program involving proof of immunization. Now, businesses which implement these restrictions, implement the restrictions exemption program using government proof of vaccination could immediately serve vaccinated patrons who present proof of immunization without any restrictions except for mandatory masking. So what this means is that anyone who has valid proof of immunization or has a negative result from a privately paid for COVID test, so this is either a PCR test or the rapid antigen test, in the previous 72 hours can access some services, businesses, or events without having to physically distance. And if a business chooses not to implement a restrictions exemption program, they are then required to adhere to all of the new public health measures that I just walked through. Businesses such as grocery stores and retail establishments are not eligible to implement a restrictions exemption program and will need to follow all of the new health measures. The restrictions exemption program will ultimately increase vaccination rates across the province. And this will decrease the risks of COVID transmission in the locations where the program is implemented. And I encourage every eligible Albertan to get fully immunized as soon as possible. It's free, it's safe, and it's easy. All you have to do is call 811 or visit your pharmacy today. And I know that this is a lot to digest, and I know that these measures impact everyone. Declaring a state of public health emergency is a significant step. But these are the steps that we need to take now more than ever to interrupt the growth in COVID cases here in Alberta. We will work hard to support businesses and other partners in understanding these measures. Now, in fact, our colleague, the Minister of Jobs, Economy and Innovation, Minister Schweitzer, is going to begin consulting with businesses at a town hall tonight. And we will continue to prioritize getting more Albertans vaccinated as soon as possible. The other side of the coin are enormous efforts being made to expand capacity in our healthcare system. Dr. Verna Yu, who's the CEO and President of Alberta Health Services, will give you a more detailed update shortly on the work that's underway by AHS to create capacity. And this continues to be the most important priority that AHS is focused on right now. But it comes at a cost. Thousands of surgeries and medical procedures have had to be canceled to create capacity in our hospitals and ICUs for unvaccinated Albertans. Vaccines are the only way out of these public health restrictions and to protect lives. Before I conclude, I just want to talk a little bit about My Health Records, which, as you should know, as most people will know, is the portal through which we as Albertans have access to our personal health information, our personal health records. And I want to apologize for the difficulties experienced by Albertans in accessing My Health Records over the last 24 hours. Significant improvements to My Health Records are being made as we speak, and for the time being, Albertans should avoid logging into My Health Records to download their immunization records. The printable card, which was going to be made available on Thursday, will not be available until Sunday morning. Additional details will be released as soon as they are available. And I want to stress that Albertans are able to use their existing records, whether they receive them from a pharmacy like I did or from AHS, when the proof of vaccination requirements are implemented on September 20th. And even after September 20th, you will be able to use your original copies or a screenshot of a previous screenshot you might have had, or when you get access to My Health Records, or a photo that you might take of your original copy to show proof of your vaccination. And we realize that this system is imperfect and some people may choose to abuse the system, but unfortunately this is unavoidable. And that's why in the coming weeks we'll be introducing a QR code that will be a much more secure format. It will be downloadable similar to the similar version that's being done in British Columbia, and details will be announced as soon as possible. Thank you. I'll now invite Dr. Hinshaw to provide today's COVID-19 update. Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. I want to begin by recognizing all the healthcare workers who are doing everything they can to manage the rapid and accelerating impact of COVID-19 on the healthcare system. We are in a crisis, and we must urgently work together to again deal with COVID. We posted our daily update online at 3:30 p.m. as usual, so I won't review all of today's numbers. However, I do want to pass on my condolences to the loved ones of the 24 people whose deaths were reported to Alberta Health in the last 24 hours. Let me pause there. That is one person's life lost for every hour of the day. Every death is a reminder of the seriousness of this virus and why these actions that are being taken today are so critical. It has been a long pandemic, and I know that many people continue to grieve the loved ones that they've lost. Preventing more deaths is another reason why vaccines are so critically important. Vaccines are safe and they save lives. I cannot stress enough the importance of being fully vaccinated, not only for our own health, but for the health of our fellow Albertans, our friends, our families, and our neighbours. We need every person who is eligible for vaccine in this province to step up. This is especially true for those who are between the ages of 30 and 59, but it applies to everyone who's eligible. Vaccines are the key to preventing not only more sickness and deaths, but also protecting our healthcare system. The impact of this wave on our health system is already worse than any of the 3 waves that came before. This crisis impacts all of us. The integrity of the healthcare system is essential to delivering urgent and non-urgent care to those who need it most. AHS has taken steps to increase capacity to care for those who need it, but that is just one piece of the puzzle. It is equally vital that we reduce the rate at which COVID is spreading across the province. I know this is difficult. Albertans are not alone in having had to bear unbearable burdens during this time of COVID. In every country around the world, COVID has waxed and waned in different ways, taking lives and livelihoods, as all of us have struggled to find a balance between COVID's direct and indirect impacts. However, the challenge we face right now is uniquely severe in the context of Alberta's last 19 months, and our response must meet the challenge. To ask Albertans yet again to step up to protect each other through activity restrictions after all we have been through is agonizing, and yet it is absolutely necessary. Our hospitals cannot sustain care for all Albertans with the dramatic and rapid increase of COVID patients that we are seeing. Although vaccines are highly protective, the Delta variant is extremely infectious. I want to be crystal clear, the majority of COVID patients in hospital across the province are not vaccinated. However, we are also seeing some double vaccinated individuals who are vulnerable or immune compromised who are still getting COVID after 2 vaccines, and sadly some are still dying. We are offering a 3rd booster to many of these populations, but protecting those who may not have a full vaccine response is yet another reason for otherwise healthy people to choose to be fully immunized to protect their community. As I told colleagues earlier in a session this week with primary care physicians, I made recommendations earlier this summer based on the best information I had, and I regret that we began a move to an endemic transition too soon. We shifted our approach as soon as evidence showed hospitalizations were not decoupling from cases as we had expected, and I have continued to update my recommendations as our situation has changed. This is why I recommended a package of new restrictions for our province. And as Chief Medical Officer of Health, I want to take a few moments to explain some key features of the new restrictions being put in place. First of all, these restrictions will apply province-wide. I know some may wonder why I did not recommend a regional approach, and the answer is simple. While case numbers are highest in urban centres, they are high everywhere right now. This is a provincial concern. In fact, right now, hospitalization rates for COVID-19 in rural areas are almost triple that of Edmonton or Calgary, highlighting that this is a province-wide challenge that requires province-wide solutions. This is why we're implementing provincial measures and why it is critical that we all embrace them regardless of where we live. The new restrictions are also very broad. There will be sectors, including restaurants, fitness, and places of worship, who may wonder why they are included. These areas, along with many others, have faced and embraced restrictions many times over the past 18 months. And I know this has been difficult, with severe consequences for many people in these sectors. I want to stress that no single sector or area of our society is driving this spread alone. Instead, it is the result of close contact that occurs whenever people gather together, especially indoors. This means no one sector is to blame, and it also means that we have no choice but to include many different areas where people can and do interact in ways that increase transmission. Each of these new measures acts as a layer to help stop transmission. They are meant to work together to reduce the risk of COVID-19 and to bend down the curve again. After more than a year and a half of this pandemic, there is significant evidence and literature about how the virus spreads and the risks of transmission. We saw in past waves that a layered approach across multiple sectors can bend down the curve. I know that restaurants, gyms, faith communities, and others have worked incredibly hard to protect those they serve. I wish these steps were not necessary, but they are. I cannot speak strongly enough about how important it is that we all follow these measures, and for each of us to consider how we can reduce in-person contacts with people outside our household as much as possible. I ask all of us to go above and beyond the minimum requirements and to do everything we can to stop spread. Our choices have never mattered more. The choice to be fully immunized saves lives. The choice to reduce close contacts saves lives. Following the mandatory isolation order that continues to be in place whenever we have any COVID-19 symptoms and if anyone tests positive, saves lives. We have seen similar measures work throughout different stages of the pandemic. These new steps can and will work if we all support them. I ask all of us to also be mindful of the mental health impacts of our current state. We need to be compassionate with ourselves and others to the best of our ability. Kindness has also never mattered more. Please be gentle with yourself and with others. We will get through this too. The more we can do that together, the better we will all be. Together we can do this. We have bested COVID-19 before, and we will do it again. Thank you, and my colleague, Dr. Verna Yu, will now provide an update from Alberta Health Services.
Good evening. We are facing our greatest challenge as a provincial healthcare organization at a time when most of us had hoped that this pandemic would be close to over. Our healthcare system continues to experience severe capacity challenges, greater than we have faced throughout this long and exhausting pandemic. Yesterday, we reached 270 patients in ICU. That is the highest number of ICU patients that we have ever seen at any time during the pandemic or ever in our provincialized healthcare system. Our ICU capacity was at 88%, but remember, that is taken into account the additional 132 surge spaces that we have opened to meet demand. Without those spaces, we would be at 156% of our normal capacity. There would not be enough ICU beds for those who need them. Because of this increasing pressure, we are taking two extremely difficult steps. We will be reaching out to other provinces to see if they have any available ICU space where Albertans could get the care that they need, as well as asking them if they have skilled frontline staff who may be willing to come to Alberta to assist us. We remain hopeful that it will not come to this as we continue to add critical care capacity. In addition, we are taking further steps to educate our clinical teams on our critical care triage protocol. We are doing this because the number of patients needing ICU care continues to rise rapidly, and we need to be prepared. The number of COVID patients in ICU has increased by 29% in the past 7 days alone. This protocol has been developed as a planned and predetermined province-wide approach to guide our response should the demand for life-sustaining critical care support become greater than the available resources. And by resources, this includes beds, ventilators, life-saving equipment, healthcare workers, and medications. If activated, the triage will be provincial in scope, applicable to all health facilities and critical care units in Alberta, developed and led by highly trained critical care physicians and staff. The protocol will ensure a fair and equitable process is applied to all Albertans. To be clear, the protocol has not yet been implemented, and it would be an absolute last resort. We want you to know that we are training our clinicians, and we want to share with you the reasons for doing this. We will continue to do all that we can to add capacity, and we will continue to do this until we've exhausted every single option. I would once like to again acknowledge our incredible physicians and healthcare professionals who somehow continue to go above and beyond the call of duty. I'm grateful and thank you for everything that you do every day. We are also sorry to all Albertans who are impacted by the postponements of surgical procedures. How difficult this must be. We wish we didn't have to do this, but it is necessary to increase our capacity. To any Albertan who has not yet been immunized and who may be hesitant, I urge you to reconsider. If you have questions or fears, please reach out to a healthcare provider or call 811 or visit the AHS website. Please stay well, stay safe, and thank you for your attention.
Please limit yourself to one question, one follow-up. We do have a lot of folks looking to ask questions today, so we're going to start with the phones. After the phones, we're going to jump to Edmonton, and then we're going to finish here in Calgary. So with that, and could you please direct who you're going to direct your questions to? With that, operator, can you please put through our first caller?
Thank you. Yes, the first call is James Keller, Globe and Mail.
Hi there. A question for the Premier. You said your government was wrong to treat this as an endemic, which could have guided your response over the last 2 months. And as Dr. Hinshaw said, that's fueled this increase in infections, hospital admissions, and deaths. You've apologized, but will there be any more accountability, resignations or firings, a public inquiry? I'm just wondering, what consequences will there be for this disastrous miscalculation?
Well, first of all, James, I would say that we are doing everything we can to increase capacity, to reduce transmission, and to increase vaccinations. That is our focus. Our focus is not on politics. Our focus is on results to address the emerging crisis in our healthcare system. There we'll have plenty of time when we get past the COVID crisis to do a full retrospective and a lessons learned. I'll say that jurisdictions all around the world have been learning about how best to cope with this. Up until now, Alberta has had a per capita fatality rate well below the national average in Canada, about 1/4 of the U.S. per capita fatality rate, about 1/3 of Europe's per capita fatality rate. And according to think tanks like the Oxford University Blavatnik Center, did so with less damaging public health restrictions. We have to recognize that those restrictions themselves have dire consequences for many people. So I think that over the duration of the 19 months of the COVID-19, Albertans have risen to the challenge. Right now, we have another challenge to face, and tonight we're outlining our actions to do so.
Thanks, James. Do you have a follow-up?
Yeah, I'm just wondering, I mean, there's this pattern in this province of your government, resisting intervening even though cases skyrocket. You mock public health experts who warn a crisis is coming, and then you finally impose measures when, hospitals are full and it appears there's truly no other option. I'm just wondering, why does this keep happening, and why does your government appear unable to learn from previous mistakes in the pandemic?
Well, again, James, I'll point out that we've had a fatality rate lower than Canada's, far lower than the United States, far lower than Europe's, and we did that broadly with less damaging restrictions. I've always been clear that we've treated restrictions as a last and limited resort because we acknowledge that there's not just one health risk. We saw last year by far the highest number of opioid overdose deaths in our history. Well over 1,000 deaths, and undoubtedly much of that was connected to COVID response. We have seen, as you know, growing evidence of a mental and emotional health crisis emanating from the COVID response. We've seen in many studies about other worsening health conditions, including obesity, which can be correlated to bad COVID outcomes. We've been trying to maintain a balanced perspective about all of the health risks throughout the pandemic. And at this point, we all have to come together to focus on slowing transmission urgently, increasing vaccination as much as possible. I will say that is one of the challenges that we are facing. I think unique to this province and perhaps Saskatchewan is a much lower vaccination rate. Despite our very best efforts, I think we've gone deeper than any province. We were the only province to have offered physicians a billing code to reach out to their patients to offer them objective information on the vaccines. We have had by far the most generous incentives to encourage people, and we have some success stories. I mean, here in Calgary, 83% of the adult population have received at least a first dose. We took, with concerted effort, working with community organizations, took one of the most under-vaccinated neighborhoods in upper northeast Calgary and turned it into the single most highest vaccinated neighborhood in the province. That has helped to save lives. So we've pushed so hard on the vaccines, and yet, we are still about 10 points below the national average. That's very discouraging, but we're not going to give up. I think that, James, another point that we have to acknowledge is that so much of this is about human behavior. I know that for some, they think governments can just flick a switch and suddenly change the behavior of 4.5 million people. It simply doesn't work that way. And here, right now, what we're experiencing, for example, in are the models that we had developed over the past 19 months are no longer reliable based on the current patterns of behavior that we are seeing. Of course, most of those ending up in hospital are unvaccinated. And there seems to be a pattern where many of those folks, well, first of all, they're not testing, so they're not showing up in our case numbers. Secondly, they're not isolating or cooperating with contact tracers. And thirdly, many are not presenting to hospital until they have very advanced symptoms going straight into ICU. So many of the patterns of behavior that we had predicated our policies on for the first 15 months or so have changed pretty dramatically in the last couple of months, and we're sorting through that with today's response.
All right, thank you. Operator, can you please put through our next caller?
Thank you. Safe Hazard, 660 News.
Hi, good evening. I wanted to follow up on that question with Dr. Hinshaw. Dr. Hinshaw, you admitted you failed Albertans at a panel with doctors a few days ago. You and the Premier just apologized for shortcomings. We were the only jurisdiction which called COVID-19 an endemic, despite countless health experts saying otherwise, showing you and this government with data which you ignored. A previous Alberta Chief Officer of Health left his job over eating a cookie 11 years ago, and we're not talking about a cookie here. We're talking about almost 2,495 people who have died now. Are you going to vacate your role in what you've admitted was a disastrous miscalculation?
I want to be clear that what I said to my colleagues, the primary care physicians, earlier this week was a comparison. So I trained as a family doctor and geriatrician in addition to my public health role. And what I told my colleagues earlier this week was just like when I was treating elderly patients who had complex medical conditions, where when you treated one condition, you could cause another condition to become worse. I care about all of the conditions of my patient, the population of Alberta, and I have always looked at all of the health outcomes that Albertans have and done my best to provide information and recommendations based on what I thought was the best thing for the overall health of the province. Earlier this summer, based on the information available to me at that time, based on recommendations that I received from again, others who I was consulting with, based on consulting with other colleagues. As you know, the three Western provinces all moved to release restrictions because all of us were looking at the data and all of us believed that we would see a decoupling similar to what was seen in the UK. As you know, in early August, when we saw that the data began to diverge from what we expected, we changed that approach. So all I can say is, just as when I was treating an elderly patient, when I felt that the treatment I was providing was making another condition worsen, and I needed to perhaps back off a little bit on one treatment in order to balance that overall health, I provided recommendations in the same way earlier this summer, based on what I believed at that time to be the best for that patient of the population. I have continued to adjust recommendations as I've gone along, and I continue to offer my services to Albertans as I am deeply, deeply committed to the overall health of the entire province. And as I said in media availability last week, it is Albertans' choice about who they place their trust in. All I can do is do my best to serve, and I do every single day.
Thank you, Dr. Hinshaw. Saif, do you have a follow-up?
Yeah, I don't believe you answered my question whether or not you plan to resign. I'd like to follow up with the Premier instead. Mr. Kenney, it seems no matter what you do here, you can't please everyone. When you put these restrictions in place, people are up in arms, and they're still up in arms when you remove them. When we keep getting these restrictions and removing them as soon as we get anywhere close to a plateau. I'm wondering, are we planning here on keeping these restrictions in place until the pandemic is over? And do we need a new Chief Medical Officer of Health if she's admitting and your government's admitting here disastrous mistakes were made? 2,500 people almost have died.
Dr. Hinshaw has my full confidence. I think we've been very fortunate to have a thoughtful and dispassionate Chief Medical Officer who has taken a balanced approach. I said that every jurisdiction in the world has been struggling with these issues. And if you compare Alberta's performance to the rest of the world, certainly the rest of the Western world, let's say North America and Europe, I'm proud of how this province has done. When you talk about the fatality rate, I will remind you that our fatality rate until now has been below Canada's. It's been about 1/4 of the United States and about 1/3 of Europe's, and we did that with less damaging restrictions that themselves impose negative health consequences on people. So I appreciate the advice that we've received. I also accept that the government accepted the advice and evaluation that was based not on arbitrary data points, but on the real lived experience of other jurisdictions with similar levels of vaccination, like, for example, the United Kingdom. On your first question about the duration of restrictions, the answer is we simply don't know. And there's one thing we've all learned through COVID, which is the unpredictability of the disease. We don't know at some point, we do know this. It's an obvious epidemiological truth that at some point, through either vaccination or people getting immunity through prior infection, that the virus will run out of people to infect. But we're not there now, clearly not there now. And we don't know what that moment will be. We also don't know what future variants may bring to us and how they will interact with vaccines. What we do know is this. Right now we are facing a crisis in our hospitals that requires action to increase capacity, to increase vaccinations, and to reduce transmission. We're calling on all Albertans to step up, particularly those who are unvaccinated. As I've said, the choice not to get vaccinated is not just a personal choice. I hear a lot of that talk about it's my choice. Yes, it is. No government is going to come along and put a jab in your arm without your consent. But please understand that your choice does have consequences for our hospitals, for your neighbors, for our whole society.
Okay, operator, can you please put through our next caller?
Rick Bell, Calgary Sun.
Good evening. This question is for the Premier. And as I listen to you, I realize how this is a very, very difficult night when I reflect back to Canada Day and the Open for Summer. Very difficult night. I realize you said we were wrong, and for that I apologize. And I know some of the people in the media have tried to ask you about this, so I'm going to try again. This question is not for Dr. Hinshaw. It's not for Minister Shandro. It's for you. To what degree is what has happened between July 1 and now a reflection on your leadership? There are people of all political stripes who are angry with you. There are people who are United Conservative Party voters who are angry with you. I dare say there are people among the United Conservative Party members of the legislature who are angry with you. There are people who want you to resign. There are people who want you to give a more fulsome apology than the one-sentence apology you gave. There are people who say they do not have confidence in your leadership at this time. I just think Albertans deserve more than we were wrong, and for that I apologize. So I'm giving you the opportunity now, Premier, to say something more to Albertans than just that one sentence.
Well, sure, Rick. As I said, and as Dr. Hinshaw has said, we were wrong in talking about moving this from pandemic management to endemic management in July and August. I frankly don't think we were wrong to lift public health restrictions in July. We actually saw that case counts and even the Delta variant continued to stabilize and even come down through most of July, even after large public events. And I also think it's critically important to understand that at least in this society, you can't sustain serious intrusions into people's lives permanently. This is, and so I don't apologize for the decision to relax public health restrictions in the summer, supported by the data, when numbers were declining and vaccine numbers were going up, supported by the experience of other jurisdictions around the world, to have maintained damaging restrictions, all through the summer, would, I think, have only resulted in massive noncompliance and even more anger. You talk about anger, there would have been no shortage of it if we had told people that despite the numbers in the summer, we were going to maintain lockdown-style policies. Second point I want to make, Rick, is that one of my main concerns through COVID has just frankly been the morale of people, their mental and emotional state of well-being. And so, yes, I said a lot of optimistic things in the summer because I think it is the job of a leader to convey a sense of hope and optimism, not a sense of despair and pessimism. And from the perspective of where we were in July, there were good reasons to be hopeful and optimistic. We have seen things change and we are responding accordingly. And so what matters is that we face the challenge head on as it emerges. That's what we're doing now. But if the alternative is just kind of permanent, unmovable, consistent, hard lockdown style policies, I think you would see even greater anger than the frustration that you see today.
Okay, Rick, did you have a follow-up at all?
Yes, just a quick one. Getting back to the initial question, though, my question was about your leadership. So again, not the health minister, not Dr. Hinshaw, and I understand what you said in the first answer. But to what degree do you think your leadership has failed between July 1 and now, if at all, has failed between July 1 and now? And if it has failed, how are you going to get people back together when, as I said in my previous question, there are people all over the political map who are in varying degrees angry with you personally, Premier Jason Kenney, you, the person, the Premier,
Sure.
They're angry with you.
So
how do you deal with all that, and how does it reflect on your leadership, your personal leadership?
So, Rick, I don't think this is about me. I think this is about protecting our hospitals. And we have to do what is necessary to do so. Rick, I said in my opening comments that we all know that regrettably there is deep division in our society about how best to address the challenge of COVID. We have, on the one side, people who have been advocates of hard, permanent lockdown style policies that I think the vast majority of Albertans would not tolerate. On the other side of the spectrum, we have people who believe COVID isn't real or that its threat is massively exaggerated, and that's clearly not the case either. What we have sought to do, what I have sought to do as Premier, based on the best public health advice, is to navigate a safe and sensible middle ground approach, one that did not always and immediately turn to damaging restrictions as the only policy response, and yet one that has dealt with these waves as and when necessary to protect our healthcare system. That has been our approach. I think it's an approach that has served Alberta well to this point. Now we're facing a new challenge, and we have to step up united in doing so. And I don't think this should be about politics or personalities. It should be about the imperative of coming together to increase vaccination rates, reduce transmission, to protect our healthcare system.
Okay, thank you. And if I could just ask our reporters in person and on the phone to try to keep your questions to be as brief as possible. I want to make sure we get to as many questions as we can. And with that, let's take our final call from the phones before we jump over to Edmonton.
Tyler Dawson, National Post.
Hi, this question is, the first one I guess is probably for the health minister. What's the purpose of having restrictions on gatherings, like private indoor gatherings, for people who are vaccinated?
Thank you, Tyler. It's a fantastic question because the answer is right now we have pressures on our healthcare system. It's right now mostly those who are unvaccinated that are presenting and putting that pressure on our hospitals as well as on our ICUs. But there is still some cases in our communities through those who are vaccinated, like me. And right now, for us, with the pressures, the unprecedented pressures that we're seeing, as Dr. Hinshaw and Dr. Yu spoke about on our healthcare system, for us to take measures right now to try to reduce the case transmission that we see in the community, to try to bring down the cases that we see in the community, to then be able to bring down the cases in general and whole in our hospitals. So that's the thinking there. Dr. Hinshaw, further context from you for Tyler's question.
Sure, I would just say that one of the analogies I've been using lately is that of a forest fire. So if you think about a fire, if it burns hot enough, even if there's some fuel around, some wood that's been wetted down in advance to prevent it from burning, if the fire gets hot enough, it will find any small areas or bits that can burn. And so as our transmission rates are so high right now in the province, and there are some people who are fully vaccinated who may not have had as robust an immune response, we know that it is possible for some people who have been double vaccinated to still have breakthrough disease. While the double dose of vaccine from our own data is about 85% effective against preventing infection, that leaves still about 15% of people who may possibly still get infected. A smaller percentage of those would go on to have severe outcomes. But again, right now, the transmission risk is so high that it's really important for every single Albertan to be a part of preventing ongoing transmission and protecting our healthcare system.
Thank you, Dr. Hinshaw. Tyler, do you have a follow-up?
I do, yeah, and this one's for the Premier. You've alluded to the sort of frustration and anger. I mean, we saw protests at hospitals and stuff that have sort of been about this sort of vaccine passport thing. I mean, so what do you say to those people who are going to be angry about this announcement and feel their rights are being violated? And sort of make it kind of a two-parter, but is there any way to prevent the unvaccinated from, still hanging out? I mean, health inspectors aren't going to be raiding people's, basements.
On the second question, look, I said earlier that one of the challenges we're facing is that, I mean, obviously the pressure on the healthcare system is coming overwhelmingly from unvaccinated individuals. And I don't say that again to stigmatize people, it's just a reality. Undergirding that, we're talking here about at least some of the unvaccinated population who I think are probably so skeptical of COVID that even when they have symptoms, they're not getting tested. When they do test positive, many are refusing, according to our contact tracers, to self-isolate. And many are not presenting to hospital until their symptoms are very severe, and many are going straight into ICU. Similarly, one of the paradoxes for us in trying to come up with the right policy response to the current crisis is how to address that in a cohort of the population that is obviously the least likely to comply with public health restrictions. And frankly, that's one of the big issues we've been spending a lot of time trying to think through over the past couple of days. There is no easy answer, but what this new policy allows us to do, the restrictions exemption program, the proof of vaccination program, is to say to those folks, okay, you're not going to get vaccinated. If you're not going to get vaccinated, we are going to say that coming into a discretionary activity where there's a higher risk of transmission simply isn't appropriate. So I would say that it's not a decision we wanted to make. You know, back in April, May, I was on a call with all of the premiers and the Prime Minister, and every one of us expressed opposition and skepticism about proof of vaccination programs for privacy rights and other reasons. I think we all had legitimate concerns and reasons. And now, over half of the provinces have adopted policies like that, because I think we've all come to the conclusion that we have virtually no other tools left in the toolkit. If you're talking about a segment of the population that broadly is not willing to follow public health restrictions, then you've got to use another tool, and that is what we are doing here. It also allows us to keep businesses open. On the first question, you know, I was very disappointed to see some people decide to go and protest at hospitals. I can't understand why anybody would do that. They have a right to protest, and they have freedom of speech. I would just say to people who are passionate about that perspective, please consider for a moment the hundreds of people who are fighting for their lives in the hospitals right now who ended up there because they are unvaccinated. This is not an abstract debate. This is flesh and blood. It's life and death. It's real. And so I just hope that the reality of what's happening in our hospitals will cause some of those folks to perhaps rethink their approach to the issue.
All right. Thanks, Tyler. We're now going to jump over to our first two questions in Edmonton. And just a reminder to the folks there to please limit yourself to one question, one follow-up, and please identify yourself and your news outlet when you come to the podium. Thank you.
Hi, it's Jeremy Thompson with CTV News in Edmonton here. This question is for Premier Kenney. Premier, you spoke about the potential anger from increased restrictions had you brought them in or had them remain over the summer. Now we're talking about desperate people dying in overflowing ICUs. How can you compare potential anger with 2,500 dead Albertans?
Well, again, every loss of life is tragic, and our condolences go to all of the families who have been affected over the past 19 months. There is not a jurisdiction in the world that has avoided COVID deaths. Here in Alberta, our per capita fatalities have been lower than throughout the Western world. And that is thanks to the responsibility of Albertans. We have always regarded restrictions as a last and limited resort, because in a complex free society like this, you simply cannot put 4.5 million people under a permanent lockdown. I don't, because it just breaks down. You require the consent of people to change their behavior. And if you ask people to massively interrupt their lives indefinitely, for going on 2 years, I think that the level of compliance would be negligible. So I think we have used restrictions as a necessary tool when we have had to intervene during waves to slow transmission and protect the healthcare system. It's what we're doing again here today. But really the solution to all of this is not restrictions. The solution to this is vaccination. And that's why, once again, we urge people to step forward, and we think that the new proof of vaccination tool will be helpful in that respect.
Thank you, Premier. Jeremy, do you have a follow-up to that?
Yeah, just a clarifying question. Do you or don't you apologize to Albertans over your government's pandemic response? I believe you've said both this evening.
No, I apologize for having embraced the public shift from pandemic to endemic, which was clearly premature, but also for having been too enthusiastic about maintaining a full openness. On that, I was clearly wrong, and for that, I apologize. I don't apologize for having lifted public health restrictions in our Open for Summer plan. I think what we were doing in July was necessary, and it was justified with the numbers. Saskatchewan and British Columbia, other jurisdictions around the world, and at similar points, of course, relaxed public health restrictions. So I don't apologize for not maintaining lockdown-style policies permanently, but I do apologize for having been, having predicted that we could be open for good, when clearly the Delta variant and the behavior patterns that we are now seeing are posing a threat to our healthcare system. So that's the answer.
Okay, thank you. We're now moved to our second question in Edmonton before we jump to Calgary. And if we do have time, I'll come back to Edmonton. I know there's a couple of you with questions, and we're just facing the clock here. So with that, I'll take that second question.
Hi, it's Janet French from the CBC. Premier, you referenced human behavior, unpredictable human behavior patterns that you've said have changed dramatically recently, which makes the modeling off. So I'm curious, in July, when you said that Alberta was open for summer, open for good, and then you lifted all restrictions, that would have changed people's patterns of behavior. We don't see in other provinces where people also have potentially unpredictable patterns of human behavior, hospitals becoming overrun and you describing this as an emergency or a crisis. So do you really believe that you are blameless, that your government had no role in creating the scenario we're seeing in hospitals today?
Well, specifically what I was referring to, Janet, is what appears to be a significant number of people who are symptomatic but are not getting tested, and a larger share of people who are testing positive, who are close contacts, who are not isolating, and who are not presenting to the hospitals until they're very sick. So through most of the pandemic, we had fairly consistent case to hospitalization ratios, and we predicated our early warning system and models on those ratios, which was, people getting sick, typically getting tested, testing positive, presenting early if they had serious symptoms. And what I'm saying is that now what's happening is a lot of folks who are getting sick have not been tested, they're not getting tested, and so we don't have that early warning, and they're showing up at the hospitals very late. So the ratios that our models and early warning system were based on have changed pretty dramatically recently, and that is a challenge we're having that we've had in terms of our modeling recently. That was the point I'm making.
Thanks, Premier. Janet, do you have a follow-up at all?
Yeah, also for the Premier. So in a Facebook Live on September 1st, you said that your government would take any targeted measures necessary to protect the health system. But AHS officials and other health professionals have been warning us for at least a couple of weeks, possibly longer, that hospitals were already under significant strain. It's also the third consecutive wave where medical experts were calling long before you acted for you to act. So what were you waiting for this time?
Well, we are constantly looking at the data, of course. We presented a modeling 2 weeks ago, which, as you could see, go back and review, had the high scenario within our maximum healthcare capacity. We took measures then 2 weeks ago with additional public health interventions. The trends since then have been surpassing the high case scenario, and so we received advice this week to institute to bring forward these other measures, and that's exactly what we are doing. I received these recommendations on Monday night, Tuesday morning, and we basically have been meeting nonstop to finalize the package that we just announced.
Okay, so we're going to jump over to Calgary, and just a reminder to folks here to state your name and the outlet you're with.
Hi there, it's Alana Smith with the Canadian Press. My question's for Premier Jason Kenney. Doctor, you just mentioned that they're thinking about implementing triage protocols at Alberta Health Services if it were to come to that. What responsibility do you take in letting this wave get so far out of control that healthcare professionals may soon have to make the extraordinarily difficult decision of who lives and who dies? And what evidence suggests these measures will prevent that from happening?
Well, with respect to evidence, I'll defer that to Dr. Hinshaw. What I will say about what we must do now is increase vaccination rates and reduce transmission. That's what these measures are designed to do. We do have the advantage of just under 80% of the eligible population having had at least a first dose. Of course, there are more Albertans who have some degree of immunity through prior infection. And so that is a radically different context than, let's say, the first, second, or even the third waves. These are very real measures. Most importantly, they help us to create safe social and business places while also further incentivizing vaccine take-up, which is absolutely critical. I mean, that is where Alberta is falling behind. It has fallen behind, having the lowest vaccination take-up in the country. I don't know what more we could have done in that respect, The only policy we had not used was this proof of vaccination requirement, and we're announcing that tonight. Obviously, no one wants our medical professionals to have to use triage protocols, and the very prospect of that is disturbing, and that is why we're taking these measures.
And Alana, do you have a follow-up at all?
I do, yeah. I'm just going to follow up on Janet's question there. Since you last announced some measures to protect against COVID-19 on September 3rd, about 90 Albertans have reportedly died from COVID. ICU admissions have increased by at least 70% and hospitalizations by 50%. Healthcare workers have continuously pushed your government to enact stricter restrictions for weeks on end. These cases and hospitalizations didn't come from nowhere. There were many warnings from healthcare workers and experts. So why today, why now, and why did it take this long to implement this range of measures?
Well, again, we implemented measures just under 2 weeks ago. We then analyzed the data. We saw that our trends were moving above the high case scenario in our modeling, and that is why we have come forward with these wide-ranging policies here tonight.
Okay, and now I have time for one last question here in Calgary.
Hello, this is Jason Herring at the Calgary Herald. This question's for Dr. Deena Hinshaw. Dr. Hinshaw, the Premier said only a few minutes ago that he received recommendations for public health measures on Monday evening. He said this one asked why he didn't act sooner. So I guess my question then comes to you, why did you not act sooner by putting forward these measures earlier?
Well, I'm going to step in there. I mean, I take responsibility ultimately for the policies of the government. And once again, we're assessing the data since our last measures were put in place. We had modeling which suggested that we would be able to manage the capacity, the pressure on the healthcare system in terms of capacity with the high model. When we saw that was not the case, Health came forward with additional recommendations that have been adopted by the Cabinet. So I appreciate the advice that we have received, and if Doctor wants to comment further on that, she's welcome to.
Thanks, Premier. I would just say that my team and I have continued to offer recommendations throughout the entire pandemic as the situation has changed. And when each new set of modeling or each new change in circumstances has come forward, we have brought forward at that time the recommendations, and then, as it has always been the case, there are choices made about what are the best measures to implement. So that's just been the continuous process.
Okay, Jason, do you have one follow-up?
Yeah, this is for the Premier. In early June, your Executive Director of Issues Management said the pandemic is ending, accept it. You said June 18th you didn't see a scenario in which hospitalizations rise, yet alone we're overwhelmed, and you attacked the media for, quote, promoting fear. These have been kind of emblematic of the way your government addressed those who raised alarm when government moved to remove all restrictions. How can you justify now, or how can you expect people to take you seriously now as you move to this more somber and serious tone?
Well, we have consistently not agreed with those who have called for hard, permanent lockdowns. We think that the broader cost of that to the health of our society, people's mental and emotional health, would be intolerable. We have used restrictions as a necessary resort to address waves of COVID-19. We've done it effectively. We're doing that again, and we just call upon Albertans to rise to the challenge, as they've done before, to reduce social interaction, to reduce viral transmission, and to take this situation very seriously, but most importantly, wherever possible, to get vaccinated. So I've already addressed the question about what was clearly a premature commitment to move from pandemic to endemic management. But once again, I don't believe that maintaining hard, wide-ranging restrictions indiscriminately, regardless of the numbers, would have served us well either.
Okay, thanks, folks. We have time for one more question from Edmonton, and then we'll call it a night. So can the last question in Edmonton please state your name at the podium and ask your question, directing it to who you'd like to speak to.
Hi, this is Lauren Boothby from the Edmonton Journal. I'm not sure who this question is for, but among all of these restrictions that you've announced. It says they're mandatory, but I haven't seen any consequences. So are there any fines? What's going to happen to people who don't follow them? And it might be difficult for some of these businesses now to enforce these restrictions after months of people being used to this. So how are you going to deal with that?
Thank you. So these will be restrictions that are enacted through a Chief Medical Officer of Health order. And the consequences of contravening an order is the same as it's been throughout the pandemic, which I guess Dr. Hinshaw or Dr. Yu would be able to speak to. And so those at AHS are public health inspectors, the executive officers in public health who, it's usually on a complaints basis, go out and work first with those who are not complying with an order, and being able to help understand first why they are not complying with an order, and trying first to use education. And throughout the pandemic, the public health inspectors have found that that first tact has been often successful in trying to get compliance as a first resort. And then after that, then the options become fines at that point. But perhaps Dr. Yu, that's a question you'd be able to answer on behalf of the public health inspectors who work for HS.
Okay, and Lauren, did you have, oh, pardon me.
Yeah, our public health inspectors have done really an incredible job, because it's not been easy to do some of the enforcement. But I do want to emphasize that their number one strategy in enforcement is actually to work with the businesses and the communities. It's really about education, it's about support, it's about how best to make sure that they understand what the issues are, and to educate them to make sure that they're able to comply. And to be frank, 99% actually do a great job. So just want to commend our public health inspectors and the communities and businesses for working with them.
Thanks, Dr. Yu.
Okay, sorry about that. Now, Lauren, I'll ask if you have a follow-up at all.
Yes, I do, but I would like a clarification. So I imagine there will be fines. Maybe you'll be releasing that later. So I wonder if one of you can just confirm that. But I have a question for Dr. Hinshaw. Dr. Hinshaw, I find it hard to believe that you only recommended this to the Premier on Monday. When did you come up with a list of restrictions and to first recommend them to the Premier? And how long has it been since you recommended them to when he's put them in place?
As I said, throughout the pandemic, we have assessed the evidence and brought forward recommendations on a regular basis. And the exact timing, the specific recommendations, as I think is a part of the public record, it's something that the cabinet confidence in terms of the details of what exact recommendations came forward and when those recommendations came forward, those are matters of cabinet confidence. And so again, what I would say is that throughout the pandemic, we have looked every time there is new evidence emerging at the impact that has on recommendations, and then brought forward any adjustments that might be required.
Thanks, Dr. Hinshaw. That wraps up our media Q&A for tonight. I know there's some folks who are still on the line and in Edmonton and we didn't get a chance to get to. Don't hesitate to send me your questions or give me a phone call tonight, and I'll do my best to get you an answer ASAP. Thanks, folks.
Thank you.